Hello and welcome. My name is Ernesto Romero, and I'm a specialist in HIV care. Today, I want to talk with you, not at you, about something incredibly important: the 10 early-stage HIV symptoms in men. My goal is to be your wellness partner in this conversation, someone who truly cares about your health. By the end of this video, you'll know what signs to look out for, and I hope you'll feel informed, empowered, and reassured. Remember, knowledge is power, especially when it comes to your health. Now, you might be thinking, HIV. That's something I don't need to worry about, right? I feel fine. Or maybe you're feeling a bit anxious because you had a risky encounter and aren't sure what to expect. Wherever you stand, take a deep breath. This isn't about fear, it's about empowerment. HIV, human immunodeficiency virus, is a virus that can be managed if caught early. The trouble is, the early signs can be sneaky. They often mimic a common flu. In fact, most people who get HIV initially experience a bunch of flu-like symptoms within a few weeks of infection. It's called acute retroviral syndrome, but let's keep it simple. It's your body's first reaction to HIV. During this time, the virus is multiplying rapidly and your immune system is mounting a defense, which is what causes these symptoms. Here's the kicker: not everyone gets noticeable symptoms in the early stage. Some men go through this phase feeling totally fine, or with symptoms so mild they barely register. That's why HIV can sometimes fly under the radar for years. You cannot rely on symptoms alone to know if you have HIV. The only sure way to know is to get tested. Let me say that again. If you think you might have been exposed, get tested. There's no shame in it. In fact, it's one of the bravest and smartest things you can do for yourself and for those you love. But knowledge of symptoms is still vital. Why? Because if you do experience these signs and you know what they could mean, you can act on them. Think of symptoms as your body's fire alarm. A fire alarm doesn't always mean there's a fire. Sometimes it's just a drill or a bit of smoke from the toaster, but you still investigate, right? In the same way, if your body's alarm bells go off, especially several at once, you check things out. You don't panic, you take action. And taking action early can literally save your life or keep you healthy for the long run. Before we dive into the symptoms, I want to set a hopeful tone. We live in 2025, and the landscape of HIV has changed dramatically. HIV is not a death sentence. With early diagnosis and modern treatments, people with HIV can live long, fulfilling lives, careers, families, dreams intact. I've seen patients who, after starting treatment, have an undetectable viral load, meaning the virus is so well controlled it doesn't show up on tests, and they feel just as healthy as anyone else. So as we go through these early symptoms, remember, even if you or someone you know has HIV, there's a lot of reason to be optimistic. Alright. Let's get into these 10 early symptoms. I'll not only list them but also describe how they feel, why they happen, and what you might want to do if you notice them. And because I care about you, I'm going to do it in a way that's informative and supportive, like a friend who happens to know a lot about this topic. Let's start with the one that often hits first. Number 1. Fever and chills. A fever is often the very first sign of early HIV in men. We're not talking about a slight "I feel a bit warm." It's usually quite high, often over 38 degrees Celsius, 100.4 degrees Fahrenheit, and can even spike above 39 degrees Celsius. Trace. It comes on as part of those flu-like symptoms I mentioned. Picture this: a week or two after a risky sexual encounter, you suddenly feel extremely hot, your forehead is warm and you're sweating. You might pop a thermometer in and see 102 degrees Fahrenheit. It's easy to say, must be the flu. And indeed, it could be just a flu. But this fever and acute HIV often arrives alongside other symptoms. It's your immune system's alarm system going off. Your body has noticed an invader HIV and raised its temperature to fight it. What makes the fever of acute HIV a bit different? Two things to note: timing and context. Timing, because these fevers typically happen 2 to 4 weeks after infection. Context, because they usually don't come alone. They bring their buddies. Chills, night sweats, feeling wiped out, the whole package. If you have a high fever that lasts more than a few days and doesn't respond much to usual doses of meds like acetaminophen, pay attention. Especially if you also have any of the other symptoms we're discussing. Let's talk chills. Chills often go hand in hand with a fever. They're the shivering, teeth-chattering episodes where you feel cold even though your body is hot. One minute you're burning up, the next you're shaking under a blanket. It's a confusing mix that leaves you feeling weak. In early HIV, these fever and chill cycles can persist for several days. Imagine having such intense chills that you're wearing a hoodie in bed, then an hour later throwing it off because you're sweating. That kind of fluctuation is exhausting. Now, I want to emphasize, fevers are common with many infections. If you only have a fever and none of the other symptoms, it's likely just some everyday illness. But if that fever is unusually high, doesn't break in a day or two, and is accompanied by things like swollen lymph nodes or rash, that's when your body alarm should be taken seriously. Don't ignore a persistent high fever. It's your body asking for your attention. In the context of possible HIV exposure, it's worth getting a medical opinion. Doctors, by the way, will usually ask about your risk factors like unprotected sex or needle sharing if you show up with a fever and flu-like illness, because they're trained to consider acute HIV in those cases. You don't have to self-diagnose, just be open and honest with your healthcare provider about what's been going on. They will guide you without judgment. Number 2. Night sweats. Have you ever woken up in the middle of the night completely soaked in sweat? I'm talking about drenching night sweats where your sheets are damp and you feel like you just ran a marathon in your sleep. It's not just a light perspiration. It's as if your body turned on the sprinkler system while you were out. This can be an alarming symptom, and it's commonly reported in early HIV. Night sweats often accompany the fevers we just talked about. Here's why. During the day you might have periods of fever and feel hot. Then as the fever breaks off and in the early hours of the morning your body goes into cooling mode and you sweat a lot. It's a bit like your internal thermostat overshoots. These sweats can happen night after night during the acute infection phase. Many men say, I woke up and had to change my shirt or even the bed sheets. It was that bad. It can be scary if you don't know what's causing it. Now, to be fair, night sweats can happen for other reasons too. Maybe you piled on too many blankets, or you have an infection like tuberculosis, or other medical conditions. Even severe anxiety or certain foods like spicy meals before bed can sometimes make you sweat at night. So once again, context matters. What sets HIV-related night sweats apart is their persistence and the fact they come with this constellation of other symptoms: fever, fatigue, etc. Think of it this way. If you're repeatedly waking up drenched and you know you usually keep your room cool and you've never had this happen before, that's a sign to dig deeper. Your body might be saying, I'm fighting something big here. In our context, if that something big could be HIV, getting tested promptly is wise. One more thing. Night sweats are not dangerous in themselves, but they can be very uncomfortable. They might disrupt your sleep, leaving you even more tired during the day. A practical tip for coping with night sweats, whatever the cause, is to wear light, breathable cotton clothing to bed and use moisture-wicking sheets if you can. Keep a glass of water at your bedside to rehydrate after a sweaty episode. But beyond coping, remember to address the root cause. Recurrent night sweats warrant a medical look, especially if you have risk factors for HIV or other infections. Number 3. Swollen lymph nodes. Let's move to a symptom that you might feel from the outside. Swollen lymph nodes, sometimes just called swollen glands. Lymph nodes are those small bean-shaped bits of tissue you have in your neck, under your jaw, in your armpits, groin, and a few other places. They're part of your immune system. Think of them as bases where immune cells gather to coordinate an attack on invaders. When you get an infection, these nodes often swell up as they fill with cells and fluid to fight off whatever's bothering you. In early HIV infection, swollen lymph nodes are very common. Your body is recognizing the virus and those immune cell bases are lit up with activity. Men often notice it in the neck. Maybe you're shaving or just touching your throat and you feel tender bumps along the sides or under the jaw. Let me share a little story composite of real cases I've seen. A guy in his 20s came in worried because he felt a lump on his neck that hadn't been there before. He'd also had a bad fever and sore throat 2 weeks prior that he thought was flu. The fever went away, throat got better, but this lump remained. He admitted he'd had unprotected sex about a month before all this. We ran an HIV test, and it turned out positive. That little lump was actually a big clue. Now, swollen lymph nodes happen with lots of illnesses, not just HIV. If you've ever had mono, the kissing disease, or even just a nasty cold, you might have felt your nodes puff up. The key difference is usually the duration and the combination of symptoms. With a typical cold, nodes might swell a bit but go down quickly as you recover. In acute HIV, nodes can stay enlarged for several weeks, even after other symptoms resolve, because the body is still trying to fight the virus which, unlike a cold, doesn't just go away. How do you check? Gently press in the areas I mentioned. In the neck, use your fingertips to feel just under your jawline and down the sides of your neck towards your collarbone. Normally, lymph nodes there are tiny piece-sized and you might not even notice them. If they're swollen, you'll feel a bump, maybe tender, in the armpit. Feel high up in the center of the pit. In the groin, along the crease where your thigh meets your pelvis. They might do blood tests including HIV tests and perhaps give you some meds to feel better if it's a different infection. Swollen nodes are basically a sign, immune system in action. They're not dangerous by themselves, but they point to something that your body is reacting to. Your job is to figure out what that something is, ideally with a professional's help. Number 4. Skin rash. Onto something you can see, a skin rash. This one can be tricky because rashes come in many varieties and can have dozens of causes. But there is a particular kind of rash that often appears in early HIV infection. Typically it's a flat or slightly bumpy red rash. Many people get it on their torso, chest, or back. It can also show up on the face and neck, and sometimes on the arms or legs. Let me paint a picture. You might notice broad areas of redness, maybe little red bumps, that aren't clustered like pimples but more spread out. On lighter skin it looks red or pink. On darker skin it might look more purple or just darker than the surrounding skin. A key point: this rash often isn't very itchy. That's one way it might stand out from, say, an allergic rash or heat rash, which tend to itch a lot. Some patients have told me they only noticed the rash because they happened to look in the mirror, not because it was bothering them. Others do feel a burning or slight itchy sensation. Experiences vary. The rash usually comes a bit after the fever starts, maybe a few days into the illness, and it can last a week or more. To share an example, I recall a patient who thought he had a reaction to a new laundry detergent because he got this rash on his chest and upper arms. He changed detergents, but the rash didn't go away, and in his case it actually did itch a little. Along with the rash, he'd been having night sweats. Once we tested him, we found out it was acute HIV. He was caught off guard. Rash was not something he ever linked with HIV. This is common. People usually associate HIV with immune problems or maybe later stage issues like weight loss, but not a rash. Yet, about rash and skin issues are super common in HIV. Up to 90% of people with HIV have some kind of skin change during the course of their illness, early or late. So what should you do if you see an unusual rash? Again, consider the context. If you've been outdoors hiking, it could be poison ivy. If you started a new medication, maybe it's a drug rash. But if none of the usual suspects are there and the rash shows up along with these other symptoms we talk about, raise an eyebrow and consider getting checked. A dermatologist might recognize an HIV seroconversion rash if they see it, but often it's subtle. Honestly, a general practitioner might not identify it just by looking either, unless they put 2 and 2 together with your history. The good news about the acute HIV rash is that it usually fades on its own as the acute phase passes. It doesn't leave scars. While it's there, you can treat it symptomatically if it bothers you. Cool compresses, over-the-counter antihistamines. If it's itchy, though often it's not itchy. But, as with all these, treating the symptom isn't enough. We need to confirm if it's HIV causing it. If it is, then starting HIV treatment will help not just the rash but ensure your long-term health. If it's not, well, you've at least ruled something out. Number 5. Muscle and joint pain. When people say I feel like I got hit by a truck during a bad illness, it's often the muscle and joint pain they're referring to. Aching arms, legs, back, stiff neck, sore joints, basically everything hurts. This is a common complaint in early HIV infection. It can range from mild to just feeling a bit more achy than usual when you wake up to quite severe, like you have a case of influenza where even moving hurts. Why does this happen? The underlying reason is inflammation. When HIV first invades, it spreads through your body and your immune system releases all these chemical signals, cytokines for the science geeks among us, that tell different parts of your body to ramp up defenses. Now, men are sometimes conditioned to push through pain or shrug it off. It's because I played ball last weekend, or I must have pulled a muscle at the gym. Those are common thoughts. And sometimes that's true. This sudden flood of immune activity can cause inflammation in muscles and joints, leading to pain. If you've ever had the flu and felt that deep bone ache, you know what I'm talking about. It's similar in acute HIV. But if you have widespread aches that can't be tied to a specific activity, and especially if they come along with, say, fever or fatigue, it's less likely to be just that you overdid it exercising. In early HIV, muscle and joint pain often comes with that overall feeling of being unwell. A practical insight: this symptom can make you feel very old even if you're young. I had a patient, a 30-year-old guy, who said, "Doc, I swear I feel like I'm 80. Everything hurts for no reason." He actually came in thinking he might have rheumatoid arthritis or something because his joints were so stiff. Turned out it was acute HIV causing those issues. Once he got past the acute phase and started treatment, those pains resolved. To cope with muscle and joint pain, general measures can help: staying hydrated, warm baths with Epsom salts, Gentle stretching and over-the-counter pain relievers like ibuprofen, which also fights inflammation, can provide relief. However, avoid heavy exercise when you feel this way. Your body is busy fighting an infection, and pushing your muscles too hard could actually make you feel worse or prolong recovery. It's a time for rest. From an emotional standpoint, enduring constant pain is draining. It can make you irritable or down because you can't get comfortable. If you find yourself in this boat, achy and miserable, take it as a cue to pause and prioritize your health. Don't just drown it in painkillers and carry on as normal. Check in with a doctor. Explain all your symptoms. Again, context is king. Muscle pain with fever and rash. That's not from lifting weights. That's your body fighting something. Number 6. Fatigue and weakness. Now let's talk about fatigue. Not just "I didn't sleep enough last night, tired," but bone-deep exhaustion. This is the kind of fatigue where getting out of bed feels like a monumental task, where you're tired even after sleeping a full night, and you have zero energy to do the things you normally do. In early HIV infection, fatigue is extremely common. Your body is using up a lot of energy combating the virus, and that leaves you feeling drained. I want to emphasize how profound this fatigue can be. One man told me, "Doc, I'm a personal trainer and suddenly I could barely lift the lightest weights or finish a short jog. I'd come home and collapse on the couch. That's when I knew something was really wrong." For him, that unexplained weakness was one of the red flags that led to an HIV test. Fatigue can hit every aspect of your life. You might find yourself struggling to concentrate at work, nodding off during the day, or skipping social events because you just don't have the stamina. It can also be emotionally distressing. Some people feel guilt or frustration. "Why am I so lazy lately?" Let me tell you, it's not laziness. It's your body waging war internally, and that uses up a lot of your reserves. It's like your body's battery is being drained by an app running in the background, the immune response that you didn't even know was running. In the context of early HIV, this fatigue comes on fairly rapidly over days to weeks and can be disproportionate to any apparent cause. If you ran a marathon yesterday, okay, you'll be tired, that makes sense. But if you're wiped out and all you did was your normal daily routine, and especially if this comes with other symptoms, fever, etc., take note. Coping with this kind of fatigue means giving yourself permission to rest. Our society often pushes men in particular to tough it out and keep working or keep taking care of responsibilities even when sick. But sometimes the most responsible thing you can do is pause and heal. Try not to rely on caffeine or energy drinks to push through. They might perk you up briefly, but you could crash even harder later and they won't solve the underlying issue. Good nutrition, hydration, and simply time for your body to recover are crucial. If you do see a healthcare provider, mention the severity of your fatigue. They might check some basic labs. Sometimes acute infections can cause things like anemia or affect your adrenal gland, etc., which could contribute to fatigue. An HIV test at this juncture, if warranted, can provide answers. Some people actually first come to the doctor only because of fatigue, with no idea it could be HIV. It's that impactful. So don't ignore severe fatigue. Your vitality is a signal of your health, and if it's gone, find out why. Number 7. Headaches. Headaches are one of those symptoms that can be both common and yet debilitating. In early HIV, many men report persistent headaches or even migraines. This can be due to fever. Fevers themselves can trigger headaches, general illness, or sometimes more direct effects of the virus causing inflammation in the meninges, the lining of the brain. Now, this doesn't mean HIV is immediately causing something like meningitis in the first couple weeks, though rarely it can. That's very uncommon. Usually, it's a garden variety headache, but it can be quite intense. What does it feel like? Often like a tension headache or a migraine. Throbbing temples, pressure behind the eyes, or a band-like sensation around the head. Some people might also feel light-sensitive and nauseated if the headache is strong, which can confuse things because nausea could be from a migraine or from HIV or both. If you are someone who doesn't normally get headaches and suddenly you have them frequently over a span of days or weeks, that's something to pay attention to. If you do have a history of headaches or migraines, you might just chalk it up to that. But again, look at the full picture. Headache plus fever plus maybe swollen lymph nodes, that combination should raise an eyebrow. One of the challenges with headaches is that stress and anxiety can also cause them, and finding out you might have been exposed to HIV is definitely anxiety-producing. I've counseled people who were waiting for their HIV test results, and the stress made them sleepless and headachy, and they started to wonder if it was a symptom or just their nerves. It can be tricky to separate, I know, My advice is don't try too hard to self-diagnose each symptom in isolation that can drive you crazy with worry. Instead, promptly get tested so you know what you're dealing with. If it's not HIV, you can then explore other causes. If it is, you'll get the care you need. Meanwhile, treat the headache like you normally would. Hydrate well. Dehydration is a sneaky cause of headaches too. Rest in a dark, quiet room. Maybe take a pain reliever if you're not medically opposed to it. Sometimes, frankly, the headache of acute HIV will laugh in the face of Tylenol and not go away completely. That persistent nature, "I've had this headache on and off for a week now," is what makes it stand out. If a headache is ever extremely severe, like the worst you've ever felt, or comes with a stiff neck, or confusion, or sensitivity to light to the point you can't function, that's an emergency. While it's unlikely, acute HIV could open the door to other infections or issues due to immune system disturbance. So you don't want to ignore severe signs. For a typical moderate headache, seeing your doctor soon, not necessarily unless it's extreme is enough. But for a thunderclap severe headache, go to the ER. They'll check you out for things like meningitis or other neurological issues. It's rare, but I need to mention it because health is full of surprises, and it's better to be safe. Number 8. Upset stomach, nausea, vomiting, diarrhea. Moving down to the tummy. Yes, early HIV can mess with that too. Some men experience gastrointestinal distress, including nausea, vomiting, and diarrhea during the acute phase. It's as if the body is saying, "Every system go haywire." For a little while, not everyone will get all of these. Some might just feel queasy, others might actually throw up, and some might get loose stools. Why does this happen? The exact cause isn't fully understood, but it's likely due to the widespread immune response. There are lots of immune cells in your gut. Fun fact, a huge part of your immune system is in the gut, and when HIV comes in, it can affect those cells. Also, the general inflammatory chemicals I mentioned earlier can affect the stomach and intestine, making them more sensitive or irritated. If you've ever had stomach flu, gastroenteritis, you know how unpleasant nausea and diarrhea can be. In acute HIV, these symptoms are usually milder than, say, a norovirus infection, the classic cruise ship bug. You might not be running to the bathroom 20 times a day like with a bad food poisoning, but even a few times a day of diarrhea can dehydrate you and weaken you. And nausea might kill your appetite, which is bad when your body needs nutrients to fight an infection. Let's say you find yourself with a case of diarrhea out of nowhere. You haven't eaten anything suspect, no one else around you is sick, and it coincides with a time you also feel feverish and tired. That's when the thought of an acute viral syndrome like HIV should cross your mind or your doctor's mind. On the other hand, if you went to that new taco truck and the next day you've got stomach issues but no fever or anything else, it's probably just the food or a coincidence. Dealing with these symptoms, focus on supportive care. Hydration is key. Drink plenty of fluids, water with electrolytes if possible, sports drinks, oral rehydration solutions. If you're vomiting, take small sips gradually. Over-the-counter antidiarrheal meds like loperamide can be used if needed. But if you suspect an infection, sometimes it's better to let it run its course unless it's severe. Then medications can help. For nausea, remedies like ginger tea, crackers, or anti-nausea medications can be considered. One important note: diarrhea in the context of HIV could also be due to other infections, since HIV can initially confuse your immune system. Sometimes people get transient other gut infections. If it's severe or doesn't improve, doctors might test your stool for other pathogens too. Most of the time, the nausea and diarrhea of acute HIV are self-limited. They will resolve as the acute phase passes. But again, we don't want to just treat the symptom and miss the forest for the trees. If these symptoms are part of the acute HIV picture, identifying the infection early is so beneficial for treatment. Today's HIV treatments, antiretroviral therapy, are easy to take and very effective, especially when started early. So while you're sipping that rehydration drink, waiting for your stomach to settle, make a plan to get that HIV test if the situation warrants. Number 9. Mouth ulcers and other sores. The last of our early symptoms is one that can be literally in your face. Mouth ulcers. Some men, when going through early HIV, develop sores in the mouth. These can be small, painful ulcers, often white or yellow with a red halo similar to canker sores. They might pop up on your tongue, inner cheeks, or lips. Even the throat can get ulcers, which might be part of why the sore throat feels so bad. Less commonly, some men also notice sores on the genital area, like on the penis or anus during acute HIV. Those are usually shallow, painful ulcers too. Why do these happen? Acute HIV, as part of the immune freakout, can cause what's called mucocutaneous ulceration. Essentially, the mucous membranes, which line your mouth, genital tract, etc., can develop these ulcers as the body's immune cells are superactivated. Another possibility is that because your immune system is busy, other minor infections that cause ulcers like yeast or other viruses can take advantage and cause issues. From a personal comfort standpoint, mouth ulcers are a nuisance. They make eating and drinking painful. Imagine trying to enjoy a meal but there's this stinging sore on your tongue every time you take a bite of food or sip coffee. It can really affect your quality of life, even if it's a small thing. For genital sores, a lot of men might not even notice a small ulcer on the penis if it's not very painful. Others definitely do, especially during, say, intercourse or urination if it stings. Sometimes these get mistaken for herpes, since herpes can cause similar ulcers. In fact, early HIV can coexist with a herpes outbreak because the stress on the immune system can trigger herpes if you have that virus dormant in you, so it can be a bit complicated to sort out. Regardless, any new genital sore, go get it checked. There's no downside to having a doctor examine it and run tests for herpes, syphilis, etc., while also considering your HIV status. For the mouth ulcers, a home remedy people use is rinsing with warm salt water or diluted baking soda water. It can promote healing and reduce bacteria in the mouth. There are also topical gels like those containing benzocaine that can numb the ulcer temporarily so you can eat. Maintaining good oral hygiene is important even though brushing might hurt. Try a softer brush. Avoid spicy or acidic foods for a bit because they can inflame the sores more. The psychological impact of sores, whether oral or genital, can be significant because they are tangible and visible. You see them and you're reminded constantly that something's wrong. If you suspect they're due to HIV, that can weigh heavily on your mind. I want to say, don't suffer in silence. These symptoms, as personal as they are important clues for a healthcare provider. Doctors have seen it all. You won't shock or gross us out. Trust me. Bringing it up leads to answers, and answers lead to treatment and relief. One more thing to tie up our symptom list. How many of these symptoms does someone usually get in early HIV? It varies. Some lucky folks might get only 1 or 2 mild symptoms or none. Others get the full house fever, rash, swollen nodes, etc. Most commonly it's somewhere in between. The combination of high fever, sore throat, swollen nodes and rash is one I see a lot. If I see those together in a patient who could have been exposed to HIV, I'm definitely suggesting an HIV test. The presence of multiple symptoms is what really creates that pattern recognition. Now that we've covered all 10 symptoms, what should you do with this information? First, don't panic. All these symptoms put together sound really scary. I know, but remember, they call it flu-like for a reason because it feels a lot like having the flu or mononucleosis, and people get through those. The difference here is the underlying cause, which if it's HIV, needs long-term management. Second, if you've had a risk like unprotected sex, sharing needles, etc., and then you get these kinds of symptoms, go get tested for HIV. There are tests that can detect HIV very early now within 1 to 2 weeks of infection, like PCR tests and antibody tests that work a bit later. Early testing means early treatment. We don't have a vaccine yet, but we have the next best thing, therapy that can give you a normal life expectancy if you start it in time. Third, take care of yourself in the meantime. I mean that both physically and mentally. Physically by resting, staying hydrated, treating symptoms with over-the-counter aids as needed. Mentally by reaching out to someone you trust if you're afraid. Sometimes just talking about your worries with a close friend or a counselor can lighten the burden. Let me also bust a myth. Some people think, if I ever got HIV, I wouldn't want to know. That comes from a place of fear, but it's dangerous thinking. Knowing is so much better because nowadays knowing means doing something about it. People with HIV who take their meds properly can reach what we call undetectable viral load, which means the virus is so low that it can't be passed on to others. Sexually undetectable equals untransmittable, and it doesn't damage their body. They remain healthy. But you only get to that stage if you know early and start treatment. So, knowledge isn't just power, it's healing. As we wrap up, I want to reiterate a message of hope and support. Early symptoms of HIV in men are a call to action, not a sentence of doom. It's like your body is giving you a heads up, hey, something's going on, check it out. If you heed that call, see a doctor, and if needed, start on treatment. You can take control of your health story. I have seen the relief on patients' faces when they get on therapy and a few weeks later hear, your viral load is undetectable. That could be you or someone you know, and it all starts with paying attention to these early whispers from your body and getting tested. You might be wondering, what about later on? What if someone misses these early signs or doesn't get tested until much later? Well, HIV has later stage symptoms too, and those are related to the immune system being weaker, which can lead to infections or weight loss and so on. But the great news is many people never get to those late-stage symptoms because of early treatment. In our next video, I'll talk about 10 late-stage HIV symptoms in men, so you know the full picture of what uncontrolled HIV can do. But remember, late-stage HIV/AIDS is far less common now, thanks to awareness and treatment. Early stage is where we want to catch it, and that's why I focused so much on these 10 symptoms today. I want to end on a personal note. As an HIV specialist, I've dedicated my life to fighting this virus and caring for those affected by it. But I'm also just a fellow human being who genuinely cares about your well-being. If you're watching this, whether you're worried you might be sick or you're just educating yourself, know that I'm in your corner. The fact that you took the time to learn this tells me you are proactive and value your health. That's huge. Keep that up. Thank you for joining me in this important conversation. Stay healthy, stay informed, and never be afraid to seek help. That's what it's there for. If you found this video helpful, please give it a thumbs up and share it with others. You never know who might need to hear this. And don't forget to subscribe so you won't miss the next part where we cover late-stage HIV symptoms in men. Take care of yourself, and remember, you are not alone, and knowledge is the best medicine we have. Until next time, I'm your name, and I'm wishing you wellness and peace of mind. Stay safe and be well.